We want to talk a little bit today about body contouring and the different aspects of body contouring. I know Dr. Park the other day was talking about body lifts, and I think for the majority of people that come in following massive weight loss, the abdomen and torso area is a big area of concern for both men and women. And so that often leads to discussion of different types of tummy tucks and body lifts that you can do. But almost everybody will immediately start talking after we address that about the other areas that concern them that they have excess skin of, and mainly the arms and the thighs. And everybody will have a little bit of a different degree of skin and fat ratio. The important thing to note is that after weight loss, the majority of people will have far more skin, obviously, than fat. And so this means that liposuction alone will not contour these areas. You will need some sort of excisional body contouring, more than likely. So the arm contouring and thigh contouring can often be combined with other procedures. However, one of the things that you really need to think about in terms of the thigh contouring is that it makes it very difficult to walk and does put you at a little bit of an increased risk of blood clots. Therefore, both Dr. Park and I tend to do thigh contouring either with things like a face and neck lift or other small procedure like fat grafting that is not going to really put you down for a long time, because we want you up and walking and have the blood flowing in your legs. So thigh contouring is usually done either as an isolated procedure or with a combination smaller procedure. Arm contouring is most often paired with some type of breast or chest procedure. And the reason for that is that the scars from the upper part of your body will connect to the scars from your arm. So again, we're contouring not just your arm, but we are contouring the skin that's underneath your armpit and sort of onto your back, and we can rope all that skin in and get you an improved contour of that whole area. So the scar will go from near your elbow, but not onto your elbow, underneath your arm, down through your armpit, and often will connect to some sort of chest contouring incision, whether that's a breast lift or, in the case of men, a chest lift. These are great procedures, and again, they can actually be done together in terms of the arms and chest procedure. But typically, just to mention, one more time and really stress that, we typically don't do arms and legs at the same time, because again, if you do a 4 extremity surgery or both arms and both legs, it's really, really hard to get around. And so when you're thinking about pursuing body contouring, one of the things that both Dr. Park and I will recommend is to sort of make a priority list. So, often the abdomen is very high on that list, but for a lot of people, things like arms, thighs, or chest can actually be higher on that list than the abdomen, because these are the things that other people see when we wear dresses or other clothes that are a little bit more revealing. So just keep in mind that there's really no right or wrong way to go about post-bariatric body contouring, and everybody has a plan that's a little bit different. But those arm and thigh procedures can be very good at getting you the contour and shape that you want following massive weight loss. If you'd like to book a consult with either Dr. Park and I, just let us know, and we can schedule you a virtual or in-person consultation regarding body contouring procedures.